These guidelines will be updated based on the treatment recommendations from the International Liaison Committee on Resuscitation, and of course of the new scientific evidence that emerged since 2015. And I would say that I expect changes that are aiming at providing more physiological approach, increasing efficacy of procedures, of course, but at the same time minimizing potential risks. The application of guidelines may be influenced by available resources, and this can vary between various European regions, especially from west to the east of Europe. And this concerns not only funding, but also human resources and educational programs. Standardized resuscitation courses play a very important role in this process, and education in this field should be continuous, and training courses should be repeated so that healthcare professionals have up-to-date knowledge and sufficient skills. I think it always takes some time to implement new guidelines, so the compliance may differ in various places. With the newer monitoring methods, it requires not only the education about the updated approach, but also the equipment needs to be there. So finding funding to provide ECG monitors may delay the implementation, especially in countries that spend less GDP on healthcare, which is, for example, the case in some centers in my country. So this method has been recommended alongside pulse oximetry for monitoring these neonates that require resuscitation, because it allows rapid and continuous assessment of heart rate. Determination of heart rate may be faster with the ECG than with pulse oximetry, and we also know that this method can provide more accurate data regarding heart rate, and this could minimize the risk of unnecessary interventions. I think it's quite important that the team gets to know the equipment they work with before they start actually using it in the delivery room. As the time is priority in case of the need of resuscitation, we should be able to quickly start the monitor, know how to navigate the monitor, and to know how to quickly place the electrodes to minimize the delay in obtaining the signal of good quality. And we should, of course, despite the advantages, we should also remember about limitations of this method, such as PEA, which is the pulseless electrical activity, which could be, in such a situation, heart rate will be shown by the monitor, but in fact, the function of the heart is not effective. So remember about the advantages, but remember about the limitations as well. I think it's a big question, but to give a short answer to that, I would say that the biggest challenge is to find new evidence. So perform new studies that will provide new data based on which we could further optimize the treatment, and so that we can find the balance between the efficacy of resuscitation procedures, but also minimizing potential risks. So I would say that we would aim at finding or supporting less invasive but effective interventions and optimal monitoring measures. Several ways to approach that. For sure, I would advise reading updated guidelines and regular participation in certified resuscitation courses. This is very important. An example of such courses could be the newborn life support course from the European Resuscitation Council. This may be especially important for those professionals who have less frequent exposition to situations in which these skills are actually used or needed. And of course, additionally, taking part in conferences or practical workshops to learn about new ideas or trends may also be a good idea. One of the examples could be the courses on neonatal stabilization that are organized by the European Board of Neonatology.